Welcome back, team. I hope that you guys have made a lot of great improvements after our last webinar. We're going to switch gears and focus on the clinical side of customer service. And while everybody's trying to be good at customer service, oftentimes we don't equate it with the clinical side. We're like, just get back there, do a really good job of providing great treatment, and everything will be fine. But I think there's little subtle things that we can do throughout the appointment to ensure that hopefully our business team has set us up with really high customer service on the front end and we can maintain that throughout the appointment.
And I think back to what we said in the last webinar, just greeting our patient warmly is nice and is important.
Yeah.
But I think we're the details. Again, there's that word again, but that's what matters. Do we have, well, before I get into it, why don't you go ahead and talk about the first point? Because I was about to say is, do you have the right patient? Do you know what that patient's getting that day? Have you had it set up already? Do you? So
Yeah.
before I get ahead of ourselves, let me have
So, starting point number one is a theme that you're going to hear with both Dr. Fu and myself is you could be the smiliest, friendliest person on the planet, but if you don't know the details and aren't prepared for your patient appointment, what's the point? Don't be friendly and dumb. Be friendly and prepared. Hashtag new slogan. Don't be friendly and dumb. So you want to show your patient that you've been prepared for their appointment. There's nothing more satisfying than arriving for an appointment and they seem prepared and are prepared throughout the appointment. And so to me, a morning huddle is the best way to make sure that we're prepared. But we need to be prepared for the huddle. We don't do all of our preparation in the huddle. That would have to be like a 1 hour huddle. You do your homework ahead of time to ensure that you're bringing the right information to the huddle. Now, I know not everybody can do a morning huddle. It may end up being an afternoon huddle, or maybe you do a once a week huddle where you're looking at the entire week. I don't care about the frequency. The point is that huddle is our accountability to show that we've been prepared for this patient's appointment. So there's a lot of things that should happen before huddle. And we want to just kind of mention a few of the things that we call chart prep. Whatever you want to call it, it means you're going through every single patient and preparing for their visit. So, what are some of the things you would suggest in that process?
I know for me personally, and I wish everybody on the team did this, and I know many do, but I know many don't. Um, and I think at least it's the most effective for me. I personally will click on not only the appointment notes for the day. So I will, for example, if a patient's coming in for recare, then I look back at the previous note. What does it say for next visit? And hopefully we left ourselves some good breadcrumbs to know what we need to do at this visit. So that's an important part of the details. For example, for today's appointment, you come in for your recare. I need to pay attention to what did we do and what needs to be done next time. So in our office, for example, do we need a pano next time? Do we need to send to the orthodontist next time? Are we watching a mesiodens and it's time to send to the oral surgeon next time? Do we need to probe at today's visit or not? So all of those kinds of little details we will go ahead and put in our next visit note so that chart prep becomes easier going forward. You're going to spend the time either way, and it's going to be quicker if you've already been sitting with that patient, you've already had their notes up and ready. It's going to be easier to get those details onto the next visit note now rather than 6 months later to go, oh yeah, what did she need again? And now I have to go back and dig through everything. It's kind of inefficient. So making sure that you've left yourself some good breadcrumbs with some good next visit notes. So I will glance at the last visit just to kind of get a quick idea. Were there any things that we were supposed to follow up on? What were mom's questions last time, etc.? Did we leave where we have like chief concern for the visit? I might glance at that to go, okay, was this a pending concern? So if you haven't been good about your next visit notes, this may take kind of a cycle of time of this patient coming to get better with that. But so I start there. I also always look at the appointment notes. Why are they coming in that day? Sometimes I can just tell from the appointment note from what's written down. If it says two bite wings, two PAs, that to me it's like, okay, this is a regular recare appointment. So maybe I don't always double click on that appointment note. To me, the appointment note again, meaning whoever scheduled the appointment, when was it scheduled? Did mom call and have any concerns for the visit that she relayed to the front. Um, so that's all part of that. And then I also always look at the paperwork. I look at the medical history update because that is where we ask about, does the parent have any concerns for the visit that day. So to me, it looks really good if I've gone ahead and looked at that, and again, assuming that that 50% did their paperwork, because a lot of
Mhm.
times they don't. But even before I step into the appointment, I like to look to see, were there any concerns for the visit. For example, the other day we had a dad that his comment was, I want to discuss the overlap teeth. So in my mind, I'm like, okay, where are we with this kid's growth and development? And I was able to go back, and while she's getting her x-rays taken, I'm going back and I'm looking at that. Have we ever recommended? Do we agree the teeth are overlapping? Did she have permanent teeth before? Did we give them any heads up that this was going to be something we anticipated? And I look at our notes, and the last like two visits, mom has been the one to bring, and we know that because we document that in our notes. And my last note says that I strongly recommended seeing the orthodontist for phase one evaluation. Is the patient a candidate or not? And mom's words were, I'm on board, but dad isn't. Well, then here you go. Here's dad. So for me, to keep up with the efficiency of our day, I can already, when the assistant is done taking x-rays and I'm about to go into the appointment to do the exam, I can say, go ahead and start chatting with dad about what his concerns are and what he thinks the solutions are. And then we can pepper in how we have talked about this before. Now, am I going to mention the part that, well, you're the roadblock, sir? Of course, I'm not going to mention that, but it preps me for going, okay, he's here and let's hear what his concerns are, because those were mom's words that he wasn't
Mhm.
on board. I want to know from him what it is. But if I wait to do all of that till the end of the appointment, or if I don't even go back and look at my notes and figure out that we've had this discussion and all of that, we're just wasting time.
Yeah.
And kind of remembering from a customer service standpoint, they want to be in and they want to be out. This was a morning patient. Dad's trying to get to work. He's trying to get this appointment done so he can get kid to school. So if I'm clueless about what your concern is, we're at checkout, you're leaving, and now it's like, okay, did you have any questions, Dad? Well, yes, I was wondering about the overlapping teeth. I have not done anybody a service. Now we're going to run behind because either myself or a team member is going to be stuck having that conversation now at checkout,
Mhm.
and they're blocking the path, and it's a roadblock to other patients getting back. That assistant can't turn that room around. I can't go check another patient, all because we were not prepared with what the chief concern was. So that's just one example of preparation. But point being, you asked, how do I prep myself? I look at the previous clinical notes. I look at why they're coming that day. I look at what their chief concern is so that I can go in with some semblance of knowledge and confidence going in and not look like a fool when the parent's like, oh, yeah, what's the status of the mesia dents today? And I'm like, right?
Yeah.
It's not a good customer service approach.
And it also, if we've done our homework like we should have done, it also allows us to prepare as a team. Maybe the assistant that was with them the last time really struggled to communicate. And she's like, I was talking to mom, and mom's finally like, I'm on board, but dad isn't. And she seemed annoyed. Maybe our strategy is like, hey, maybe we should tag in assistant number two today and see if just a different approach may be helpful. We can troubleshoot any potential problem that we might have with that particular patient, that treatment. What if we noted last time that the patient was really difficult to get numb? We had it took extra cooking time before we could actually get in there and start the treatment. We can go ahead and be proactively planning for that today. Maybe instead of doing all this chit chat with the patient, we're going to immediately place that topical so that we can get in and get doctor in there faster. So it allows us to plan for the flow of the day and for patient specific needs that they have. But I love the example that Dr. Kuba gave, where if she wouldn't have done that prep with that particular parent, and now he's mentioning it as they're supposed to be on the way out, it can also have a domino effect of us just running behind, not being efficient with the time that we have. Now, are we talking about that at the front with the dad because he was already on the way out of the room? Are we going back into the room, but we need that room? Are we going to consult? Oops, somebody's already in consult. So that one little ounce of preparation that we put in allowed us to proactively bring that up. And address it while they're in a space that we meant to address it in. I would also say, too, going back and looking at the previous note is critical for everybody, including our business team member. A lot of time, our business team is just so focused on the business side, like, oh, do they have a balance or what's their insurance expecting today? But I think it's just as important for our business team members to be aware of how that last visit went. Do we know what mom said the last time she brought kiddo in? Do we know what's next on their treatment plan? Yes, you need to also be prepared for the balance and insurance estimate and all of that, but take a minute to be aware of what that last note read as, and that can also be communicated in the morning huddle. So maybe our business team member isn't going through and reading every previous note, but our RDA did her column and she's reporting to the team what was last. And now the business team is in the loop, which is why that morning huddle is so helpful. So,
I think back from a customer service perspective as well. If the dad had left the building and got in a car and is halfway down the street and he's like, wait, nobody addressed my question about these overlapping teeth. What if that wasn't his question? What if that was mom's question? And now he gets in the car and he's halfway down the street and he's telling mom about the appointment. Yeah, no cat is good. What did she say about the teeth? Huh? Remember I asked about the teeth? Oh yeah, they didn't talk about it. Why didn't they talk about it? Right. So from a customer service standpoint, I would be frustrated if I sent my husband somewhere and I had filled out the paperwork so I could ask my question and then only to have you leave and then not get that question addressed.
yeah.
Which, because then for me, that means I've got to find time in my schedule to call back. And my mind is already set to if I call back to a doctor's office, the chances of me speaking to somebody who can answer that question usually is not the receptionist. But that's who I'm going to get stuck with. And then receptionist is probably going to send me to a medical assistant and I'm going to have to leave a message there. And then medical assistant may or may not call me back. And now I've got to keep following up. And I would be super annoyed because my thought would be, why did you even ask if I had a concern? So these are the attention to detail things that I think sometimes newer team members, like if we hire a new assistant, and I'm like, you need to be looking at that medical update as well. Like, first of all, you're supposed to be assisting me that if the kid is allergic to latex or if the kid has a whatever they have, and you don't team me up for that, now I walk in and I do something.
Mhm.
You've not done your job in that regard, but on our medical history form is where we ask what's your chief concern. And if you've not helped tee us up or helped address that with the parent,
Yeah.
it's actually not a good customer service. You smiled the entire appointment and you gave Billy the blue brush he wanted. That's great. But to me, that's bare minimum. That's what you
Mhm.
should be doing. What are you doing that's extra above and beyond to make this appointment efficient and effective for that family? Because that does affect that customer service outcome.
And keep in mind, too, we want the parent or the patient to walk away with they were prepared. So if we did forget that small detail and they're having to call back, they're thinking to themselves, what else have they forgotten? What else are they forgetting? And we're trying to protect the practice and our doctor to make sure that we appear as being prepared every single step of the way. So that morning huddle is critical, but what happens before morning huddle is what's even more critical. The morning huddle is just like our last little accountability to show that we have actually prepped. And to me, without sounding too cliche, every single patient matters. So if we've got a high maintenance Mark that we know is coming in and we've got Sweet Sally that we know is not going to ruffle any feathers, we do the same chart prep. We do not prep based on patient complexity or rudeness. We prep the same way because every patient deserves our absolute best preparation and attention to detail. And so the morning huddle is a way to hold us accountable to that. We cannot miss a day. We cannot miss a patient of preparation in my mind. It's too risky to not prepare when we've got a patient coming in our door. So morning huddle, step number one.
Well, I think because that the preparation gets you prepared for 80% of your day because we never know what the other 20% is going to be.
Yeah.
The number of patients that walk in without their paperwork, the number of patients that walk in late, the number of patients that they now tell you they have this problem versus that problem. The limited exam that came in, the temporary crown fell off. Like we don't know 20%. So if we are scrambling to get up to speed with 80% of our day because we didn't even look at the original patients we had, if we didn't pay attention to those, we are chaotic and scrambling and mentally tired at the end of the day.
Yeah.
And that patients can pick up on that. And that is where the liability goes way up. So preparation matters because you will never be 100% fully prepared for your day. There will be changes and things that
Mhm.
happen. Um, but the more you are prepared for what you can prepare for, the less chaos you're making for yourself and for your whole team.
And I would say too, it directly impacts our confidence in the way that we're handling that 20% of the unknown rather than us appearing like we're out of the loop or we don't know what we're doing. Instead, we appear confident because we are, and that 20% doesn't shake our confidence. I can't tell you how many times I'm in an office where I'll hear a patient ask a question that the person that they're asking it of should know the answer, and they'll go, "Oh, let me check on that." And I'm like, "Oh, we've lost it." It sounds like something so simple. And I know that it's hard to remember every single detail in that moment. But the second we have to go, you know what? Let me check on that for you. We've we now are less confident, so we present as less confident, but also the patient feels like you probably should have known that. So all of this prep also helps our confidence and allows us to communicate confidently about everything, every aspect with the patient. So morning huddle is kind of step number one clinically for high customer service, but the prep before, and I said the day before, I have plenty of offices that will prep an entire week before because they want to have time to get their heads wrapped around what's coming up next week. Or if there's a major case, I was in an office recently and they did not realize that the patient had never had a treatment plan presented to her. And she was in for a big appointment. It was like an $11,000 case that she was coming in for that Monday. This was Thursday. And they're closed Friday through Sunday. And so she was first thing, 8 a.m. Monday morning. And they were prepping. They were doing their day before prep. And when they did the day before prep, they realized there was no treatment plan on file. They communicated with the patient via text about, hey, this is your upcoming appointment. This is the total due for that day. And the patient's response was, when in the heck did y'all talk to me about this? I did not realize it was going to be this much. Bottom line is that patient fell off the schedule because we did not prepare in advance. And in the midst of all of this breaking down in front of me, one of the things that they were doing was an implant abutment and crown, and so the doctor said, I'm sure the assistant has already checked that we have the part, but let's just make sure. This was when everything was in limbo. And so about that time the assistant pops in and I was like, hey, that case on Monday, do you happen to have the abutment? And she was like, I don't know, do we? And I like
Oh,
melted
man.
inside. I was like, okay, now we've botched it potentially on multiple levels with this patient. We didn't get the treatment plan presented. She had no clue. We communicated that via text message, which then upset her. She called in, and then we're trying to figure out how we're going to help her afford this last minute. And in the middle of that, if she would have kept her appointment, we didn't even know if we had the right parts. That is where it just crumbles.
That is where you get board complaints.
Yeah.
Because now there's so much writing on that doctor to make sure the implant is perfect. And not that the doctor isn't trying to do a perfect implant anyway, but those are the ones that we always are like, oh gosh, that's the one that's going to go south because
Yeah.
already this patient is starting on shaky ground. Like, who wants to approach an appointment that way? It is very anxiety. It's
Inducing.
yeah, very now for that patient, I guess my question becomes, well, why didn't you know? Like, why didn't you ever ask? Why didn't you ever we'll never know the answer to that. At the end of the day, maybe she thought her insurance was going to cover all of it, or who knows.
Mhm.
Um, and to me, it's thank God you did chart prep and you caught that on Thursday
Oh,
before she walked in on Monday morning.
yes.
Like I can't even imagine
Yep.
if that had happened. So yes, you've got an upset patient, but I think that's easier to spin and go, oh, well, I'm not sure how you didn't know that. I don't know. I
Yeah.
think you could finesse that a different way. But if she's taking time off work and showed up to your practice and that's what she's facing, I think that is the absolute worst case.
It is. And thank goodness there was a chart prep done on Thursday so that we could catch it ahead of time. There's a lot of other things that could have been caught had we done that a little bit earlier. So one of the things we implemented in the practice is for those bigger cases, especially things that are going to require special equipment like an abutment, we want to actually move the prep back to a week before rather than the business day before. So it's accountability. Those huddles are meant to make sure that we're prepared and that we're crossing every T and dotting every I. And every patient deserves that from us as medical professionals, but also it is a protection for the doctor, for the practice. So that's tip number one on clinical customer service. And now I want to go back to, if y'all remember. Oh,
Real
go
quick
ahead.
before you
Yeah.
do that, on the hub, there are
Yes.
documents to help you. Because if you're saying, wait a minute, you just said huddle is important, I don't really
Yeah,
do a huddle. What should I do in a huddle? We've got several great resources
we
for
do.
what you should do in a huddle. And maybe we come back and do another webinar later on just the huddle. But you've said multiple times now that it's the prep for the huddle that's important. And if you're kind of going, what does that mean?
Yeah.
Who's doing it? I'm doing it. I've got 30 patients. I got to do this for all 30 patients, or who's helping me do this? Is the hygienist? Is the front? Is it? So we've got some tips and resources for you on that, um, to see what your timeline is. Is it a week? Is it a day? Who's looking into all that? So don't forget about the hub. You can go and get some resources there to help get you started.
Yeah, and there's morning huddle samples in there in that document. So yes, go check that out. Thank you for remembering that. Okay, so we've done our huddle. Now we're going to kind of go back to the patient appointment. They've arrived. They've been greeted with direct eye contact and a happy voice
In a clean
in a
office that smells
clean and
great.
beautiful lobby where they've been thought of every step of the way. So they're just beaming with excitement to get back in the chair. And so then it can all fall apart if we don't have our clinical team teed up to have the same level of customer service. And that starts with what I would call the seating of the patient. Now, I view the seating of the patient, if you've got a door from your clinical area to your lobby, it's the second that door swings open, right? So the expression on our face, do we look like we're happy to be opening that door and greeting the patient? Or are we like opening that door and getting ready to greet the patient in a not very happy way? So we've got to get stage ready before we pop that door open. We need to have a bright expression on our face. We need to open that door and we want to keep HIPAA in mind. So it's first or last name. It's never both. I hear this happening a lot, especially in larger practices where there's a lot of activity. We might have three Johns on the schedule. And so that clinical team member is going, okay, John Jones, don't need to do that. We need to say, okay, John. And if three people stand up, then we'll deal with it at that point. Most of the time, that's not going to happen. So we open and we go, okay, John. And once John stands up, this is where eye contact comes back. We want to establish immediate eye contact with John, and it needs to be a pleasant face, like, hi, John, and some kind of greeting from him in the waiting room to me at the door. Hi, John, how are you today? John's walking towards me, and I keep my pleasant face going. And then as John comes around, then he's moving into the clinical area, and I'm walking alongside John if possible. I know some people have narrow hallways, and it's not possible to walk directly side by side with John, but we need to position ourselves that if that is possible, John knows to stand beside me and we can walk together down the hallway. We need to have a bright face, direct eye contact, a pleasant tone of voice. And again, as soon as that door pops open, our face needs to be ready. Do you have any thoughts on this section?
I absolutely do. I was going to mention tone again. Everything we talked about in the first webinar, all of that applies here. I think several little detail things because I see it happen, and it's happened to me multiple times in various offices. Hi, how are you today? And then you walk off.
Mm-hmm.
If you're not going to listen to what I'm saying, then why ask?
Yeah.
Right? So if you don't want to hear it, or you're like, well, I'm not going to ask that. Yeah, don't ask. But if you're going to ask, then we kind of need to listen to what the patient's saying.
Mm-hmm.
Same things we talked about in the last webinar. Kind of like when you answer the phone and the mom's like, oh, I've had a terrible day. Oh, okay.
Mm-hmm.
Come on back. Let's take your weight. No. If you're going to ask, how are you? And usually you're going to get the pat answer of, yeah, I'm good. How are you? Oh, I'm good. Okay, great. Thanks. Now go ahead and step on the scale. Great. But if the patient has just said, I've had the roughest morning, my dog may be passing tomorrow, we may have to put her down tomorrow. Oh, all right, go ahead and step on that scale, right? So pause and slow down. Y'all watch each other and see if somebody's been guilty of that. If you're not aware that you're doing that, um, I think when you're, to your point, if you can walk beside, I think one of my biggest pet peeves as a client or as a customer is when the person's walking behind me. So they're being polite, they're letting me walk through, but then they're behind me. Well, I don't know where to go. So now I'm standing there bumbling around and they're kind of bumbling behind me. That's where, to me, a proficient person would be like, oh, let me get on ahead. Let me show you where we're going. Or if you've got numbered operatories, that's fine. Something to guide. But I think far too often it's this foolish dance you're doing because you're kind of walking, but not really walking. But then if you stop, then everybody stops behind you. You know what I mean? So watching those little details, if you are falling behind, that's where you're saying, oh, let me get ahead so I can guide us here. Or I think I find it very silly and honestly a bit frustrating when I'm the one who's stopping to say, hey, let me just stop and let you get ahead so you can tell us where we're going.
Mm-hmm.
Really? Okay. So don't be that. Lead kindly. So if you've gotten to the back, one or two things. Hey, let me get to the front so I can show you where we're going. Or hey, we're going up to room number 3. Yep, you got it right up there. Up to the left. We're heading straight for 3. Right? So guide. You are the guide. You are the host in this home. Guide where people need to go. Um, I think the other thing, if you can't be right next to and you're not falling behind, if you are in front, making sure you're no more than a foot in front. I find it very rude. And again, I don't know that this happens in a lot of dental offices. Maybe it does. You would know better. But I know in our medical offices, I feel like 9 times out of 10, whoever's walking with us is at least 5 feet in front of us. It feels so impersonal, almost like I don't want to be near you. Don't do that. Make it be warm, as warm as you can in whatever space you can be in.
And if you are having to walk out in front of them, either due to the spacing or some patients naturally, because medical so often does this, they naturally just fall back behind you. They don't realize that you're waiting on them to walk beside you. That's fine. We don't have to make a big deal about it. Walk very closely ahead and then keep popping your head back and chatting with them. Don't just get out ahead of them. They're talking and they're talking literally to the back of your head. You want to at least keep turning back and trying to make eye contact, or at least they can hear your voice over your shoulder as you're walking out ahead of them. If you've asked, how you doing today? And then y'all start walking down the hallway and the patient drops back behind as they're talking, you want them to know that you're hearing those details. Oh, did you find any good deals at the grocery store? And you're continuing that conversation. It's not natural. We prefer to be facing each other when talking. But if nothing else, you want to at least show that you're trying to make some kind of eye contact with them as you move down that hallway. Keep in mind, everybody walks at a different pace. The patient's job is not to keep up with your pace. Your job is to keep up with the patient's pace. So if they're naturally a slower walker, if you keep moving ahead 5, 6, 7 feet, then they may feel pressured to kind of run behind you. And you're like, I am walking so slow. No, apparently you're not. You're walking a little bit too fast for that patient. So if you get out ahead of them, it's hard to tell if they're falling behind. So that's why another reason why you need to keep checking on them. If they're kind of drifting behind, you slow your pace down. If they're right up beside you and it feels like they're like eager to keep moving, then you may need to pick up your pace a little bit. So some people have physical limitations that keep them from walking quickly. So it may not be evident that they can't walk very fast, but as you start walking and they're falling behind, you need to slow down. So keep that in mind
Well,
as
and even
well.
making sure you're not losing the patient. Like you're walking and they're not following you anymore. Maybe you have an aquarium in your office and they stop to look, or maybe you've got two intersecting hallways and now they went down one hallway and you're going on their happy way to the other. It sounds silly and like common sense, but we see it so much. So just being very aware, and I think that goes back to the intentionality. A lot of times we're going, man, did I remember to get the right crown for this patient? Oh shoot, I forgot to set this up. I forgot to do that. And you're charging back to the room. But that's the patient experience. The customer service is lost in that moment. You are on stage And even if you did forget your next line, you're trying to figure out how you're rallying around that and doing that, but you can't just stop and accommodate yourself at that point. You're still considering the customer service aspect of that appointment.
Absolutely. I will say once we've made the trek down the hallway and we're getting them into the operatory, can't tell you how many times a patient hesitates on where to sit. You're like, it's kind of obvious. There's a big chair there. Like, you should probably sit there. But I would direct them. We want to remove any level of awkwardness that the patient might feel. And it goes back to when we have a person come into our home, you're going to say, oh, feel free, have a seat here or here, wherever you're most comfortable, is what we would do in our home. Or feel free to set your stuff here. You know, we're directing people on what's normal in our home. And the same thing needs to happen in the operatory. You've just had this great little chit chat down the hallway. Now the patient comes into the room. You might be out ahead of them. Y'all might be arriving at the room together. And you can say, oh, feel free to sit in that real big seat in the middle there. Just make yourself comfortable. Direct them where to sit, and they'll be more satisfied that they don't have to make a decision. Because sometimes there's extra seats in the room for family members or things like that, and they might accidentally sit there and then they feel dumb when you're like, oh no, you'll be sitting in this one. Oh, I thought that might be the case. And then now we've made it awkward for them again. So just direct them where to sit. Feel free to set your purse over on that counter over there or in the chair, wherever you are comfortable with it. So you're just giving them instructions and then they sit down. And this is something that I preach all the time, and so I don't want you guys rolling eyes at me. I can see you rolling your eyes at me, but we've got to have a moment once that patient is seated where we stop and establish eye contact again. My preference is that we sit and establish eye contact because those chairs are usually lower than us standing, unless you're really, really short. But most of the time, the patient sits, and now we're kind of towering up over them, looking at them. And so I want to challenge each of you guys, try it where you have a chair already. This is preparation. You've got that chair before you leave the op to go get your patient. You've moved your chair, the doctor's chair or the assistant chair, into the right space, which is just towards the feet of that chair. Your chair's ready there so that when that patient comes in and has a seat, you can plop down in that seat and have this moment of connection with them. I always challenge you. I call it the perfect seated position, where when we are sitting in our doctor's chair or assistant chair, we are knee to knee with the patient and we're belly to belly as close as we can. We move, let's say this is this table right here is the chair. We're going to move as close to that chair as possible, but we're not going to be too much in their space where our knees are next to their chest, let's say, because then we're going to be too physically close to them. If our knees are lined up with their knees, then it's an appropriate social distance. And then it allows us to scoot our chair in close to the patient's chair and just establish this very direct eye contact. The reason I don't like it to the side, which is what we're most comfortable with, is that then the patient is doing this to talk to us. They have to turn their head completely this way in order to maintain eye contact. Let's help our patients out by shifting forward, and now the patient can look directly at us. And we might only have a few questions. We might say, hey, I noticed on your medical history that you've started some new medication. Tell me a little bit more about that. It might just be a couple quick questions, but if that's done in that seated position, that perfect position, we feel the patient feels like we're being very intentional. We're not missing any details. How many times does a patient feel like they didn't even hear me about my new medication? I said that I was on new medication, but they were back behind me typing on the computer. It didn't feel like they were listening. So we want to make sure during that critical first couple moments in the chair where we're reviewing important information, or maybe we've already reviewed med history and we're just going over what we're doing today. We're seated down, we're going, okay, Joe, so I'm so happy to have you here today. We've been preparing for you this morning and we're so eager to get that cracked tooth taken care of. I know you're ready to have more comfort when you're chewing that food, aren't you? So, as a reminder, we're going to be doing that crown today. Any questions on that before we get started? So it may just be a brief little moment where you're reviewing what the appointment is about to be, but it's done in a very intentional way. So that seating is super important.
And I think it's very easy. We see it all the time where you get the patient in the chair and usually the computer's behind,
Yeah.
or you're grabbing things from behind in a drawer or wherever it is. And yeah, it's a hard thing to remember because you're trying to get going. Because now doctor's going to be coming in, or hygiene's going to be coming in, or whatever's happening, and you're trying to move along. But to Bethany's point, just pause for a minute and make sure you've reestablished that and you're not talking at them.
Mhm.
Because usually, if your back's to them and you're grabbing whatever you're grabbing and they're saying something, and if you're nodding your head, they can't
They
see
can't
that,
see.
right? So you've lost that method of communication. So just making sure that you are taking a moment to establish that yes, I'm here. You're, for us, telling the assistants, get the patient seated. Hey, buddy, I'm just pulling up your paperwork over here. I'm getting a few things ready, and then we'll get going.
Mhm.
That way, they're not just sitting there going, "What's supposed to be happening now?
Mhm.
What am I? Am I supposed to be doing something? Why is there this awkward pause? I don't know what you're doing." So just that communication. I think by the time you get mid morning, you're kind of going, "Oh well, I know what I'm doing. You know what I'm doing." No, for that patient, that they just got there. So
Mhm.
they don't know what you've done. They don't know that you're pulling up the chart. So making sure that you are taking moments to make that eye contact, check in so that they know that you're still with them, not that you're paying attention to something else that's going on down the hall or the next operatory.
And hopefully, we're prepared enough that we do not have to step out of the room for any reason. So, details again, let's have really good preps, have good trays set, have everything we need in the room. But if you should need to step out for any minute, most of the rooms are set to where the patients cannot see the entrance and exit doors. And I can't tell you how many times I've been in a practice observing and the patient is talking and there's nobody in there because they had to step out to grab something. How embarrassing for that patient to realize that they're talking to literally
That
nobody.
would really
It'd be
be on
awful.
my nerve. I'm like, why are you making me talk and then you're not even listening?
Yeah.
Like
Yeah.
that would
So
not be good.
it's critical that if you have to step out of the room, dismiss yourself. Say, hey, I've got to step out just for a second, Joe. I'll be right back. That way they can, first of all, not talk to themselves, but also it's very appropriate to dismiss yourself from a conversation and then to reintroduce yourself into the conversation if you have to break it. So, uh, rule number one, be prepared so that you don't have to step out. But if you do, make sure to dismiss yourself. Also, not every if the computer's at the head at the noon of the patient, then we can't always maintain eye contact as we're updating med history or things like that. So once you establish that first contact in front of the patient, and then you might say something like, "Hey, I need to get ask you a few questions on med history. I'm going to wheel back behind you. I'll be right behind you asking these questions." That way, again, we've kind of given ourselves permission to break that physical contact that we had. So just think of social norms in communication. And very, very seldom would we be with a friend talking to a friend like this. And so if we're not in direct eye contact with the patient, we need to kind of ask permission to be back behind them or at least tell them where we're going to be and why we're going to be there. Those are little subtle things to get the appointment set off on the right foot. Also, this is where kind of the quintessential customer service comes in. We need to check on things like, do they look hot? Do they look cold? Do they look nervous? Have some of those comfort conversations and say, hey, I know we keep it pretty cold in here. Do you need a blanket or anything like that? Oh, no, I'm fine right now. Well, if at any point you need that, you just let me know. And also, we have great things like headphones. If you don't like the noise of dentistry, I'm happy to get you a set of headphones. You need headphones? No? Okay, good. So, just some of those little comfort items that you have in place, and you can do that in a very calm, casual way. It doesn't have to be anything major, but be prepared with a blanket. If they say, yes, I'm actually really cold, you're like, where do we keep the blankets? Or, oh, I've got to go find one. No, make sure that you know that morning. Do we have blankets prepared? Do we have headphones prepared? So that that's something quick and easy for you to grab, and it doesn't look like you're having to go to a lot of effort to go get that.
Even little things like if somebody's wearing glasses and they want to take their glasses off and now they're holding their glasses and they're holding their bag, and or they came in with a big puffy jacket and they're going to be laying on their back for 45 minutes, and 2 minutes in they're going to want to take puffy jacket off.
Mhm.
Paying attention to those and getting that patient really situated so that you can be efficient with the rest of the appointment.
Mhm.
Offer to take the glasses and put them in a safe spot. Offer to, if you've said you feel free to put your purse here, and the lady still doesn't let go of her purse, maybe that's where when she's laying back, do you want me to set this over here for you? Um, Making sure that they know that you are paying attention to their comfort.
Yeah. Also, that will relay right into getting prepared for the doctor to come in. So, we want to make sure that we've reminded the patient what they're there for today. So, as a reminder, Joe, you're here to get that cracked tooth on the upper left fixed. We're going to do that with a crown today. Before we move on with that, any questions that you still have? Okay, good. You're ready for that. Okay, and then also my goal today, Joe, I'm here to support Dr. Kubo with this crown, but I'm also here to make sure that you're comfortable throughout the entire appointment. So I'm here for you if at any point you need a break, you need a blanket, you need to stop, or for any reason, that's what I'm here for, is to make sure that you're comfortable. So this is going to be our cue. If you need to stop for any reason, I'm going to be seated on your left side, and I want you to either reach over and raise your hand, wave at me, flick your hand up, do something with your left hand. That way I know whatever your system is for making sure that patients are able to communicate their comfort or discomfort. You need to prep the patient before the doctor comes in. And I would preface that with, I'm here to make sure you stay comfortable. So rather than just jumping into the comfort routine, preface it with a statement that makes it clear that your goal is for Joe to be comfortable. That can be very relieving for a patient. I recently had a procedure, and it was so helpful to have the assistant on the right side or on the left side. She said that to me. She was like, "Hey, do you need anything before we get started? And hey, if at any point you need me, I'm right here. Most of the time, my left hand is free. Feel free to tap me, do anything." And it was just like this confidence of like, okay, I'm fine. I can get through this procedure. So we don't, and I'm in the dental field, and that was still comforting for me to have that procedure and to know that it was like, that was my girl. I knew that was my girl, and she was with me. So we want to make sure to establish that connection with the patient before the doctor comes in.
But then you've got to be able to deliver that as well. So if you don't have all your materials prepped and you're having to hop in and out of the room, well, now you just told the patient, I'm right here for you.
Mhm.
And patient's trying to find your left arm, but you're not there because you forgot the surgical suction. You can see how that would not be, uh, elicit a lot of trust or confidence.
Yeah.
So you got to be able to deliver what you promised.
Yes. So we've talked about walking the patient to the room, seating them, having a really good start to the appointment. We also need to make sure throughout the appointment that we are checking patient comfort throughout the appointment. Some docs and assistants are naturally more wired to just do this. They're like, "Hey, you doing okay? Joe, how's it going? You need anything?" And they'll kind of have these little, it's almost like this internal clock that's going, and they know it's about time to ask that again. But some docs and assistants are not naturally wired that way. So I want to make sure it doesn't have to be often. It could be one or two times throughout the appointment where you just, either pause the procedure, or even as the procedure's going, it can be that assistant that's going, "Hey, Joe, I'm right here. Remember, you let me know if you need me. You okay?" And we've got to have a couple moments at least where we ask, even in a cleaning appointment. Even in a cleaning appointment, we're like, "Oh, this is so simple. Of course, the patient's fine." But we need to pause periodically and just ask and make sure the patient's doing okay. So check patient comfort throughout the appointment. And then let's fast forward. So hopefully we're checking comfort throughout the appointment. We're smooth, we're prepared. That treatment goes well. The 20% can happen where something goes wrong, but if we've looked really prepared through the whole thing and we're smooth throughout the appointment, then we arrive at the end of the appointment. And this is where we're going to be wrapping things up in a nice, pretty little bow. We've done all this prep to make sure the appointment ends well. So, doctor's now done. Doctor is gone from the room to, yeah, see you later.
See you next time.
Eh, customer service is absolutely important, but a lot of times I do not put the weight of customer service on the doctor. Because if I put the weight of customer service on the doctor, he or she's having to come in and Dr. Kuba calls it tap dance and make conversation and do all of this. Well, they're productive when they've got instruments in their hand. And the more that they're having to do with customer service, the less time they are being productive for the practice. I'm not saying the doctor can't chit chat if he or she likes to, or sometimes they may have to step in and support a team member with customer service. But in all honesty, I feel like the bulk of customer service falls to the team. So doctor's done with the procedure. They're out. They've done a nice little have a great day, Joe. Great seeing you. I'll see you back soon. And then our assistant swoops in, or if it's a cleaning, our hygienist swoops back in after the exam and they tie things up in a pretty little package. So it's important. We told Joe at the beginning he was getting crown on the upper left side. We're going to remind Joe at the end. Why would we remind Joe at the end? Because fear blanks out everybody's mind. We all of a sudden just forgot what happened. And I can't tell you how many times on the back end a patient calls in confused because they thought that they did the fillings and not the crown. So we want to repeat again. Hey, Joe, wow, you did such a great job today. You were such a fantastic patient. I know this sounds like it may be belittling or this is what we do for kids. This is not what we do for adults. No, no, no. Adults they're self conscious. I can promise you they may be more self conscious than the kids, and they need to hear that they did a good job. Even if they didn't, it's okay. Just say, wow, Joe, you were so tough today. Thank you for being such a great patient. And then Joe may say something like, oh, I know I was a big weenie. No, hey, it is okay. We have patients like you all the time. You did awesome. I'm really proud of how you did. Because we are setting Joe up for the next appointment when he comes back in for that seat crown. We need Joe to have a little bit more confidence than he did today. And if we are complimenting him, there's a chance that he'll come in a little bit better next time. Not to mention, patients love to know that you're satisfied with them. So, wow, Joe, great job. As a reminder, we did that crown on the upper left side. It looks beautiful. And then we move into our post op instructions. Now, you might have heard me say something there. It looks beautiful. If we're making comments throughout the treatment while Dr. Kubo or your doc is still in there, we are complimenting the doctor as well. If we get that prep done, it goes a long way for the assistant to go, wow, that is a pretty prep. That looks really good. Or wow, look at those margins. Whoo, that looks good, doc. That compliment to the doctor, you're saying it to your doctor, but the patient is going, wow, that looks really good. This happened in the procedure recently, that I had, but the doctor actually said it. He told the assistant, he was like, you see how I've stitched it this way? That skin is going to grow together so nicely. It's going to make for a perfect implant. Okay. The doctor had to compliment himself. The doctor should never have to compliment himself or herself. The assistant should have said, "Oh wow, that seam looks really good, doc. Those stitches look great." So, assistant, help your doc out. Doctor, help your hygienist out and go, "Wow, look at these teeth look beautiful. Way to go, Tammy. That was a great cleaning." If we are complimenting each other, we're endorsing the work that they've done, and the patient has trust, that has built more trust because of that compliment. So again, in this wrap up, we want to also compliment the work that was done. That crown looks beautiful today, Joe. Here's post-op instructions. Any comments you want to say on that little?
I would say for us, because in pediatrics, there's not that many opportunities, but anytime I can, say we have an operative appointment and mom's sitting there watching the assistant in Texas, you have to have sealant credentialing. And so assistant gets started with the sealants. I come in to do my part. And anytime that I can, that's when I'm like, man, look at you with that sealant. That just looks gorgeous today. Jenny, you must have been a great patient because Mary sure got that perfect sealant. I'm so excited for y'all. Good job, ladies.
Yes,
Just that little bit of endorsement right there. Any opportunity you can goes a long way.
I agree with that.
It also makes, I mean, it makes who's the assistant? Jenny, whoever the assistant, Mary. Makes Mary feel good that she was, you know, given a shout out
Yes.
to. Or if a parent is coming in and saying, I didn't think my kid was going to do well today. That for me, that's where I'm like, yep, Natalie sure has been with us for a while. She can turn kids around. Good job, Nat.
Yes, yes. Taking the time to do that, while it doesn't seem like it goes with customer service, it absolutely is a part of this customer service category because, again, we're focused on how the patient feels. And if they feel confident, they feel like, oh, wow, I had Natalie who's been here and she did a great sealant, then we're going to have a satisfied patient at the end of this. I also want to say, too, that even if we have really thorough post op instructions, we've got it all typed out, it's beautiful. We've spent so much time with this really great post op instruction, you still need to give verbal post op instructions. So, Doc steps out. We've complimented. We've reminded Joe, you've got this crown on the upper left side. Here's a few tips, Joe. You are going to be numb for a little bit. So I want you to be really careful when you're chewing. Try to avoid anything super hot for the next couple hours until we know that you've got that feeling back, etc. You know post op instructions well in written form. You should know them just as well verbally because the patient is most likely not going to read those post op instructions. So we've got to protect ourselves in showing that we did actually go over those. We're making a note. Post op instructions reviewed. Told patient not to eat hot or cold for the next, or told patient not to eat hot for the next few hours. Be careful when biting. Avoid sticky, chewy foods for the next 2 weeks until permanent crown is seated. Okay, great. We put that in the notes so that if Tim comes off while Joe's out and about eating his toffee, then we know that we at least did our part, and the note clearly says that we told Joe to avoid those types of foods. So this is where details come in. If you're a newer assistant and you don't know those post op instructions, that's your homework. You go and read those post op instructions and make sure that you know them like the back of your hand. So that if Joe says, hey, I was about to go meet up for coffee with my friend, coffee's fine. And you're like, well, wait, just 1 second, Joe. Let's look at our post op instructions together. No, no, you should immediately be able to answer Joe's questions and feel confident in those post op instructions.
And I would say if you are a newer assistant, listening.
Mm-hmm.
Put your listening ears on and listen to post op instructions as often as you can. I would also say go home and ask a layperson and say, okay, if we just done a crown on you, or have you ever had a crown? What were the instructions you were given? And practice because people will ask you something and maybe nobody's ever asked you that. The first three patients you sat with didn't ask you that. Now this fourth patient has, and if you're like, of course you don't want to make it up, um, but the more equipped you are to answer that question, I think for me again as a consumer, if I'm walking in and you don't know what I need to do to keep this crown on, my thought is, do y'all not do crowns?
Right.
Uh oh, have I come to a place where this is a rare procedure? Did this guy even know what he was doing? I thought he knew what he was doing, but the assistant doesn't even know what's norm and not norm. And I'm in a dental office. I thought crowns were pretty normal for them to do here, right? You can see how the seeds of doubt get started by somebody not knowing something that they should know.
Absolutely. So wrap this up with being really confident. Confident with post op instructions, confident in your doctor or your hygienist, pass those compliments, compliment your patient, and then you're directing them out of the room. Okay, so Joe, you can go ahead and grab your jacket over there, and I'm going to take you up front, and then you're telling them what you're about to do. So I'm going to take you up front to Tammy. Tammy's up there waiting on us, and she will wrap up today's appointment with you. And then she's also going to go ahead and schedule that next visit. Okay, so Joe, let's follow me. And you got any plans for the rest of the day? And you're kind of chit chatting, hopefully side by side with Joe as y'all walk up to the front. And this is where it is so important that we tee Tammy up at the front to be prepared for Joe. She's had, in the time that we've been back there, solely 100% focused on Joe. She's probably had 20 phone calls. She's probably checked in 10 patients, maybe checked out 10 patients. She has no clue who's walking up to her. And we cannot expect for Tammy to know, oh, Joe was with our assistant Martha. And so I should know if Martha's walking up that it's got to be Joe. No, don't put her in that position. Walk up to Martha and go, hey, Martha, so Joe, wow, he did so great today. We finished up that crown on the upper left side. He does need to come back in about 2 weeks to have that crown finished, and we'll put the permanent crown on. And man, Joe was just great today. Hey, Martha's going to finish taking care of you, Joe, and she'll get everything ready. Okay. And then we walk away. Bye, Joe. Have a great day. Now Martha knows this is Joe. He got his crown done. he needs to come back in 2 weeks. I don't even have to think about anything. I can pick right up where my team member left me off, and I can finish Joe's appointment up. It is if we walk up and we're like, okay, Martha, we are all done today, and Joe needs to come back in 2 weeks. We don't have enough detail there to actually be able to pick that up confidently. So we want Tammy at the front to be able to confidently finish out this appointment.
I think a lot of times in our own heads, we know where the patient needs to go and what they need to do and when they're coming back. The patient often doesn't know. So, once again, imagine yourself. Like, I'm sure it's happened to you because it's happened to me all the time in a medical office where the person will just leave. And I'm thinking, are we done? Are we not done? Is somebody else coming back? What was the next step again? Were we calling in a prescription? Did you call it in already? What are we doing? Do we need to come back? And that can be really frustrating, especially after you've just had an appointment where if you and the doctor talked about three different options and now you're opting option one. Do you know that I'm opting option one? Did he tell you that in the hallway that I didn't see that? Like, what? There can just be a lot of confusion. And I think that is one of the best ways to lose a patient because their minds are full or they're numb, whatever it is. The end has to be just as teed up and just as on it as the whole appointment has been, as it has been, like we talked about in the last appointment with the call. The call, the finish and the end, hopefully they remember good stuff in the middle, but at the end, that can be one where people can run in chaos or the parent leaves and now they're going, wait, I didn't get the prescription I needed. Wait, what are we doing next? Wait. If it's dad who brought, mom knew that the kid was coming back next time for the left side. Dad's not listening. Dad's like, oh, we're done. Wait, what do you mean we're done? All sorts of, so it needs to be really clear. And if you as the assistant have not prepared and you don't know what the kid's coming back for, what Joe is coming back for,
Yeah.
you need to know. You need to know. You need to look at the notes. You need to ask the questions before you get Joe out of there so that you know exactly what the next steps are. I think in our
Absolutely.
office, a lot of times it happens where a lot of times it's the doctor that's either got, I know I need to go there and I know I need to go there, or that aren't as communicative and communicate in their own heads, but they haven't said anything out loud. They leave, they're with another patient, and now this one is going, wait, what were we were doing the filling. Are we doing it with a sedative? Are we doing it with nitrous? Are we doing it today? Are we and so those details have not been clarified. And that, for the assistant, that's kind of on you. You should have asked those questions before the doctor left the room. So if your doc hasn't set you up for success, please don't keep the not setting up for success to now be the front desk problem. It makes the whole team look like we're not paying attention. And of course, that's you don't want to get up to the front and be like, "Oh yeah, Dr. Kuba didn't tell me what the next steps were. Let me go find her." Talk about not endorsing your doctor. Like all the little compliments we've given along the way, don't throw your doctor under the bus that way. It's really on you. You're the quarterback who's now taking it from one step to the next, and you need to guide that appointment in the right direction. Where are we going now? And setting that appointment up for success. So I think that's one of the biggest things that I feel like I hear a lot. Well, I didn't know. Why?
Yeah.
Why aren't you asking the question?
Yeah.
And so you need to have the mentality of it starts and ends with me, no matter who you are in that office. Even if you're the receptionist, at that point, if you're like, yeah, I don't know what they prescribed you, no idea, figure it out. What are your steps to go, wait a minute, let me efficiently figure out what it is? Are you stepping up to go figure it out? Are you calling Amy back to ask that question? Do y'all have to work on an internal system after this patient leaves and go, do not put me in that position again? What is our system here? So before you leave the room, you need to put in the next visit note that we need to call in some chlorhexidine. Then I have something to stand on. But this, I don't know, is not acceptable.
Yeah.
That is the worst customer service answer. I don't know.
And I would say, too, just like our clinical team, you guys are preparing for the patient's appointment and clinically what we're doing. Our business team should be equally as prepared. Have we looked at their insurance? Have we looked at their account balance? Have we looked at what their estimate is for today? Are we prepared so that when Martha does bring Joe up to us and we know, oh, this is Joe, this is Crown, that we aren't having to go, oh, okay, let's see, Joe, let's go ahead and collect for today. It looks like you're going to owe, $702. And Joe's like, Well, wait a second. The estimate showed $600. And Tammy at the front's like, oh, really? Let me look at that. No, no, no. We should have already looked at what the estimate was that he signed. If it is more than what we had originally quoted him, we should have already figured out why. Oh, yes, Joe, you are correct. Actually, your estimate did show $600, but it looks like your insurance short paid about $100 on your last cleaning. Unfortunately, insurance is totally common with insurance these days, but that's why it's a little bit more. So we already have an answer for any question that Joe might ask before he walks up. This last minute, like, oh, I don't know. Why did it show more than that? Not acceptable. So, our business team, you need to be prepared for that checkout process to ensure that you've done your homework and any question that Joe might ask, you've already prepared for so that that can be smooth and seamless as well. Okay, can you believe we made it start to finish on this customer service idea? There's additional things that you can do after, like you could do follow-up phone calls. Hey, how you feeling today, Joe? Or next day, how's that tooth feeling? Any problems? You could always add follow-up phone calls. But even if you don't have that in place, you don't have to have that for good customer service. If you just follow start to finish with what we've talked about today, and you focus on doing things right, being prepared, actually caring about the outcome of each patient appointment, then you're going to bring a level of customer service that honestly is not common these days. So raise the bar.
Raise the bar, and then that's like patient retention.
Mhm.
Employee retention. If employees are constantly getting yelled at, constantly running around, constantly feeling like it's chaos, they're not going to stay.
Mhm.
So it seems like a lot of work, but you're putting in the work at the front end so that you have a seamless appointment, and then you're having a predictable system,
Mhm.
and then people are happier.
Absolutely. Obviously, we have loved talking about this topic with you guys. We have lots of topics like this on our podcast, Managing Dental Drama. So we'd encourage you guys to keep this going, keep the conversation going. Find some more topics through the podcast that you need to improve upon. Dr. Kuba's mentioned the hub. We have a ton of resources. We've got a monthly consulting platform that is a subscription base that is so cheap that would give you guys things to do each month to continue to improve upon your practice. So let this be the launching point. Customer service is a great starting point, but let this continue as you try to improve not only your practice, but your patient experience as well. Thanks for joining us today. We loved having you. Bye.